How Coronavirus Saved My Life, Episode 34, The Polyvagal. Nelson Mandela said, "It always seems impossible until it's done." These powerful words, large on a projector screen at an addiction conference I recently attended, was one of the biggest full circle moments of my life. This beautiful quote, "It always seems impossible until it's done," was the introduction slide to the polyvagal theory presentation, The Science of Feeling Safe. This life-changing slide with this beautiful quote, along with an awe-inspiring, beautiful background picture of large sunbeams going through a cloud, tapping the ocean water beneath, stopped me in my tracks. I sobbed. I started this podcast, How Coronavirus Saved My Life, as a love letter to humanity. This podcast is about my journey as a healthcare worker who got coronavirus in April of 2020, followed by months of long COVID symptoms. I had a pivotal moment in my backyard where I thought I was going to die from the acute COVID symptoms and then thought healing would never come with the long COVID symptoms until I healed myself by doing self-love meditations, creating safety tools for my brain, reprogramming my subconscious, unwinding all that nasty childhood conditioning, all while regulating my nervous system and stimulating my vagus nerve. I did not fully know there was actually a science between the healing tools and techniques I incorporated during my healing journey until a few weeks ago, as I was sitting in that auditorium listening to Dr. Aria, a pain psychologist, explaining chronic pain through the lens of the polyvagal theory. The polyvagal theory, the science of feeling safe. In this episode, Dr. Aria, which he said I can call him Les, will explain the connection between the polyvagal theory and chronic pain recovery. He is a pain psychologist who's been practicing for over 18 years with Kaiser Permanente Medical Group in Northern California. And he serves as the lead pain psychologist for the Kaiser Northern California to help redesign chronic pain workshop curriculum to promote and incorporate modern pain science, mindfulness, and acceptance and commitment therapy. Les is one of the co-founders of Minda Health, which is an online pain recovery program, and he serves as the chief science officer. He specializes in treating psychological disorders, persistent pain, and medically unexplained problems. He has a passion for mind-body interventions. He has a YouTube channel, and he is a podcast co-host of Dynamic Healing. The purpose of this episode is to educate listeners about the polyvagal theory and help listeners with chronic pain discover the science of feeling safe so they can begin their journey of healing and feel safe while doing so. Thank you, Les, for coming on my podcast today to talk about healing chronic pain through this groundbreaking polyvagal theory.
Well, it's a true pleasure. I got to tell you, this is when I heard how you healed organically without all the fancy bells and whistles of a theory and interventions. It sounds like you're the right person to talk with and to spread the message. So, a pleasure to be here.
Thank you so much. When I was sitting in that auditorium, as a nurse practitioner, we have part of our licensure. We have to go to, conferences for our educational credits. And quite frankly, I usually don't really like going, but this particular, I don't know what it was, that we were just totally aligned. And that picture you had with the sunbeams coming through the cloud, the reason why part of that was a full circle moment was because when I had those acute coronavirus symptoms in my backyard, I couldn't breathe. And my brain said, you need to call 911. And then my gut said, if you call 911, you're going to die because you're going to believe it. And then I was breathing better a few minutes later, but I was still really, really hot. And I laid down on one of the lounges in my backyard and I was just like, I'm so hot. I'm so hot. I'm so hot. I just want water. I just want water. And literally there was one little rain cloud above me with sunbeams coming through and big, huge raindrops. There was no other clouds in the sky. And so seeing you and hearing this was just like, whoa, so we are definitely aligned. I love it because this is going to help so many people who have chronic pain and are so frustrated and tired of all of it. I'm very honored that you came on my podcast today to talk about this, the polyvagal theory. When I went to your website, I was blown away because there's a picture of you standing there very mindfully, and just these bold letters that say, ready for pain recovery. Your pain is real. So is the solution. I bet there are so many people with chronic pain who have never heard those words.
You're right. And very often, whether it's a physician or a therapist or a patient, we are told and we tend to believe what we believe based on what we're told. And it's kind of like with your intervention with yourself in that moment, you decided to make a different pathway in your brain. You
Oh,
decided wholeheartedly, even though you were struggling in quicksand, you did something important. I like to use metaphors to explain my messages. You basically made full contact with the quicksand, and that's what allowed you to float. You
mm,
made contact, and in that moment, you restart to retrain your brain that even though I'm going through something just overwhelming and it's a mysterious disease that we really didn't understand, right? As we went through 2020. And with your medical background, it doesn't matter, right? When you feel activated, whether it's trauma, whether it's long hauler syndrome or COVID for that matter, or life stressors, when you're activated, our human response is to push the bad things away. How do I get rid of it? But you did something intriguing. You basically made full contact with it. And it's almost like you went into the middle of the tornado and you didn't get swept up it. But even though you kept on getting pulled, you kept on centering yourself over and over. And what you were doing at that point, you were retuning your autonomic nervous system, your
mm.
nervous system in and of itself. So it's a beautiful thing. That's why when I heard your story, I'm like, I've got to get on because yes, you're right. We are very aligned. But the cool thing is you did yours in such a practical way, which is beautiful.
Thank you so much. I appreciate that. I love that. I created new pathways in my brain. I love it. I'm now that's going to be my thing. Today, I'm going to create a new pathway in my brain. You know what I mean? Like, what are we going to do today? That's actually
Right.
super exciting. I love that. Yeah, it was interesting because not just the acute symptoms. This is when I was started getting the long COVID symptoms, and they were very autoimmune like.
Mm.
And I mean, one day I looked like the Michelin man, and then the next day I was super skinny, like I had fluid. But the weird thing about it was the symptoms would just come one at a time. You would have maybe horrible brain fog for a couple hours, and then it would go away. And then numbness, tingling in my hands. And then, they were like, oh, coronavirus, you've got a sore throat. It wasn't a sore throat. It felt like a piece of popcorn in the back of my mouth. And so I was like, what? So after I thought I was going to die, and then the beautiful rain cloud with the sunbeams, I kind of collected my thoughts and came in my room, in my, quarantine room. And then I was like, what is this? I thought I was going to die a few minutes ago. What's going on? And so I pulled my books out, and they didn't really talk about the vagus nerve very much. I couldn't even really remember, which one the vagus nerve was. And, just remembering it for a test. And as I was looking at that, I was like, every symptom I have, the vagus nerve interacted with.
Yes. Yes, I mean, absolutely. And for the audience who may not be familiar with the word Vegas, and by the way, it's not Las Vegas, but
Yeah.
VAGUS, right? I made that mistake when I was first starting it several decades ago. So VAGUS in Latin, from Latin to English, it means the wandering nerve. And the reason it's dubbed as the wandering nerve, it's the 10th cranial nerve. Actually, it's the longest cranial nerve. And so it starts at the base. So it's your brainstem and it comes down, and most people don't realize it comes down the carotid, by the carotid artery. And so I call it, now I live in California, so you might live in a different state or different country. And Highway 5 is a long highway that, goes all the way from Oregon all the way down to California. And I consider that it's like a long highway, and all the exits are connected to your organs, your heart, your liver, your pancreas, your gallbladder, everything, your lungs, your guts. And then it sort of stops down there at the gut area. That is why very often when someone says, what's your gut feeling? What they're asking you is, what's your vagus gut feeling? because the vagus nerve is the nerve that communicates messages from the body to the brain and the brain to the body. So it's bidirectional. It's what we call an internal commander. So it sort of commands internal messages. And when we can correctly stimulate it, as you did, you did, again, I'm just so amazed by what you did intuitively as a healer, is what I love nurse practitioners in the sense, because you guys have a different whole, you guys have that bridge between the nurse, between the doctor, and you
Yeah.
guys pull the best worlds in. And your interventions are usually great. It's always about how can we get you healthy, not always about medications. But with
Right.
that said, the vagus nerve is really an important, vital nerve that actually communicates this, am I safe or not? So it's a very, very important, it tends to send messages. And we can unpackage that a little bit more as we go through, but I just wanted to pause to make sure people understood that the vagus nerve is a very powerful thing. And you'll hear a lot of misinformation out there about how to do it and what to do. And we want to make sure we clarify that today.
Yeah, I thank you. I appreciate that. That's actually, that was the very first episode when I was talking about, everything that happened in the vagus nerve. And I've had people said, I didn't even know what the vagus nerve, and people were now looking it up.
Yeah.
And I mean, I was on this one podcast and she was said, I can't believe when you hum to a baby, that's stimulating your vagus nerve. Yeah. I mean, I noticed that when I'm falling asleep, I always hum. Like I never knew why, but and the cool thing about the vagus nerve is that it is so easy to stimulate.
Yes.
It is there's so many really simple techniques to stimulate it.
Yeah.
But yeah, it's like a god nerve in your body. It is the nerve that's going to help you heal yourself.
Yeah.
So before we get into all that, can you give the listeners and viewers a little bit of background of where you're from, where you did your school, like where you're born,
Yeah.
like your kind of a little bit of your life?
Yes, absolutely. First, like I said, so I'm native to California, so San Jose is my hometown, and now they call it Silicon Valley, I guess. And it was a town that was beautiful, quiet. It wasn't very busy. And my claim to fame here, just on a funny note, whenever someone says San Jose, and they're like, "Where?" I said Silicon Valley. It can be anywhere around the world. My claim to
Wow.
fame is about where we lived was about 12 houses down from the same area where we lived, was where Apple Computer was built in the garage. Steve Wozniak and Steve
Mm.
Jobs. Now the funny story is I used to ride my bicycle, my red line bicycle, cool, with all my cronies behind me when I was about fifth or sixth grade. And we used to ride up and down the street, and we saw these guys with the garage open with beards and smoking. So I thought it was drugs. I went home and told my mom, these older guys, they were probably in their 20s or like, early 20s, but these old men, I said, are doing drugs. My mom's like, keep away from those boys. A year
That's
later,
hilarious.
yeah, a year later, about a year or two later, I think in seventh or eighth grade, a gentleman came to my middle school, and it was Steve Wozniak with his beard and buttoned up shirt. And Steve Wozniak is the person that actually created Apple Computer, and they taught us how to program. So that's my claim to fame, and that's where.
Wow.
So there you go. And the other thing is this about me is I'll tell you the truth on this one. It's almost funny now that I say it was not. I used to be shameful of saying this. I never wanted to work with people with chronic pain. I'm like, oh heck no, I don't want them. So during one of my clerkships as part of a training during grad school and a residency, we get exposed to different disciplines, different specialties. And one of it, I was very focused on neuropsychology. I wanted to focus on the brain, and I did do a training in that. However, when I was doing a clerkship rotation in a pain management clinic, and when my first exposure to someone with chronic pain was them picking up a chair inside the doctor's office and throwing it across the room because they couldn't get the opioids. And I sat them out, oh, no, I don't want this. I never want to work with this population. Never say never, by the way. And
Right.
here I am, 2 decades later, I'm loving this, and I'm love where my passion at. This all happened by accident when one of my patients accidentally, is what I call it, accidentally got better and the pain resolved. When I told my colleagues, I was in training then, I think I was a first year residency. I told my colleagues, and they're like, that's impossible. People don't get better. I said, no, really, I mean, this person is no longer like zero pain. They're like, well, it was psychological in the beginning. And I said, maybe it was. And so I kept quiet for several years. Long story short of this is I now am bold and speak out. I don't need someone to believe me. If you want to heal, follow the pathway, and if not, step aside.
I love that. Oh my gosh, you are speaking my language right now. You don't have to believe me. That's the
Mm.
same thing with me. Is like, here's the things that I use. It may work for you. There's many paths to healing, but I think that what you're doing right now is probably most likely not working. So these are tools and techniques I use them or not. It's up to you. I can't heal for you. But yes, one thing is like when I heal, you heal. When you
Yep.
heal, I heal. And so instead of saving and rescuing and doing all this stuff and trying to convince, here you go, you either take it or you don't. You know what I mean? That's it. you
Beautiful.
know, I love that. I love that. And you're so right about the chronic pain thing because I never thought I would have a full circle moment that would involve chronic pain. Okay. Because, as working at a hospital, the county hospital, where we have a lot of like homeless population, schizophrenic, a lot of addiction. I hate the word addiction, by the way, but I think there's a lot of shame and societal
Mhm.
stuff attached to that. But that's a whole nother podcast I could go on. But so there's all this stuff. So you're constantly like having patients, clients that are wanting benzodiazepines and opiates
Mhm.
and all this stuff. And plus being raised by a father who abused everything, every kind of drug. He didn't have any pain. Emotional pain, right?
Right.
But so, we all have our own bias, right? And
Right.
I always feel like with other providers, we always sort of have this attitude about people with chronic pain and being on opiates. It's almost
Yes.
like, yeah, but when you and your other co-presenter were talking about pain and people, because you just assume, oh, they're being dramatic. If you touch them, they're like, ow. We don't think about the metabolism and the
Yeah.
genetics and all the other things involved. And it really opened my eyes big time, because I said, we're all just making assumptions over here, and we're medical professionals, right? With
Yes.
degrees, and we're making assumptions. And I love that you had that moment. Because this is truly groundbreaking, because in my hospital, they just started about over a year ago. Like, we now have a Suboxone clinic. And I remember them talking about Suboxone, which is used to treat opiate withdrawal. And
Mhm.
then they use it for opiate dependence maintenance. And they were so excited about it. And I was just like, why are we all so excited about this? I'm like, why are we just trying to find this once again, another band-aid? Okay. And in my psychiatry world, everything seems to be fixate or focused on the relapse. What are you going to do to not relapse? And it
Mm.
drives me nuts, because I'm like, why are we not talking about why you started in the first place?
Beautiful. Yeah. That's exactly right. I think you're really getting to the root of the issues. And I think very often we don't quite understand why something happens. And if we don't understand, I think what we want to do is realize this, whether we believe emotional pain is amplifying and maintaining it, any form of mind body work you do will actually promote a sense of healthiness to the brain and the body, to the nervous system. And I think your attitude is very it's small compared to everyone else, because your opinion is very right. With your opinion, what you just said matches with modern pain neuroscience.
I love
Now,
that.
I do want to let the audience know, and I think you can agree with me on this, is we're not saying that Suboxone is bad. That's not, I don't
Right.
think you're saying. You're
Correct.
saying is, look, we need to look at other avenues. I
Right.
think we get happy when, and I agree with this. When I heard about Suboxone, I'm like, wow, this is pretty intriguing. And my first thought was, I bet you this will help doctors feel better that they can do something. Doctors, nurse practitioners, nurses, people, providers mainly that you tend to see, including physical therapists, psychologists, they just want someone to stop suffering. And I think sometimes the pill is there, like, wow, I found something, this has got to be. If the pill is the only tool that you have in your toolbox as a provider,
Yeah.
it's going to be a long
Yeah.
day.
Yeah, and yes, I completely agree, because Suboxone, definitely helps that opiate withdrawal piece. Like, you see them, and if you work on the consult medical floor, we're looked at to have the answer, and we feel
Yeah,
helpless. We're human.
yeah.
We feel helpless if we don't have an answer. And so you're right. Yeah, you're kind of opening my eyes on that, like, because I'm making an assumption. But I see a bigger vision, I just not in this limited thinking like, okay, so we're going to do this. Now what? What are we going to do that's really going to help people? And this is why I love this healing your chronic pain through the polyvagal theory. So, how did you get into the polyvagal? How did you discover this? Was this through school or what was that?
Yeah, funny. Again, it's always things I don't want to do, I end up doing. So I've stopped saying is I'll never be a millionaire. So maybe I should say more of
That's
that. So
amazing.
yeah, so the reality is I remember sitting in my first year of grad school, and one of the things my professor, who I didn't realize, Dr. Uh, Richard Gevirtz, is world renowned for biofeedback and heart rate variability, whole different episode probably. But he's very famous for showing studies on how when you do breathing, it slows everything down. And he happened to tie that biology of calming the nervous system down to the polyvagal. He says, here's the latest paper that came out. And it was Dr. Stephen Porges, the creator of the polyvagal theory, who I didn't realize they were friends.
Oh,
And
wow.
again, and you didn't realize how famous people are. You just kind of like don't realize. And so as I went through school, I just kind of put aside that paper. I had it in the back of my mind. It wasn't until my residency training and I was getting out of it, I did my fellowship in pain management and neuropsych. And in that moment, I realized that the autonomic nervous system really was, I kept on realizing that people, when they had stressful life, trauma, poor relationships, finances, I noticed that their pain was amplified. And then when I talked to war veterans, like World War II veterans who had a really happy life and they had PTSD, but they had more going in their life. They were moving towards what matters in their life. They were golfing, they were connecting with fun and safe people, they
Mm.
had beauty around them, love people loving. And I noticed that they had pain, but they weren't in my clinic as much and they got better faster. And so I found a correlation. And then I realized, and talking to my old professor, Dr. Richard Gevirtz, and basically that he highlighted the vagus nerve. And that's when the love story began. Fast forward here. So I kind of left that alone, kind of was dabbling in it a little bit. It wasn't until coronavirus. So what
Mm.
happened during coronavirus? So I had never met the person I studied, Dr. Stephen Porges, and I belong to what we call a think tank, and we call it the Wednesday group or the Dynamic Healing Group. It's a world of international researchers and clinicians. And
Mm.
every twice a month we meet and we present each other's information, from cellular things called Cell Danger by Robert Navio to all the way up to Stephen Porges on the nervous system. So these are some people who are world famous, and we invited them. And that moment, I told Stephen Porges, so I had to present on chronic pain. And Stephen Porges was not aware of anything about chronic pain because he was focused on autism and trauma and adults. And he was just kind of focused on that stuff, more of the children stuff. And that's when he started to become enamored by chronic pain. And he said, hey, this is the same system. And
Oh
as we
my
talked about
gosh.
this, yeah, so we got the guru himself. So I'm very blessed. So he has mentored me and continues to mentor me. And I don't know how and why I'm so blessed to be able to get someone. I can email him, I can call him, I can, anytime I have something about it, he helps educate me about it. And so I get it from the guru himself. So it's almost like I don't need to read his book, but I do read his book.
Yeah.
So it was, and that's how I came across it. So COVID, I made a promise to myself when COVID started. I said to myself, and I said, I have two kids, and I told them, I said, when you get out of COVID, make sure you're better than you were in it.
Mm.
So, and this is how it is. And so my betterment was basically moving towards Stephen Porges. And that's when my model of treatment tightened up a little bit more than it ever has. And when I started to use the framework of the polyvagal theory,
Mm.
it helped people feel less shame. For example, I'm meditating, I'm exercising, I have got the right dietary. I don't know why my pain is not getting better. And when I used the polyvagal theory, I explained to them how and why they were stuck. They were not damaged. They were just stuck in a loop.
I love that. I love that because literally, I have clients that'll say, I feel stuck, especially if they're in that chronic pain,
Yeah.
addiction, pain pill cycle, along with alcohol and stuff. And I love that you just said it, because that's the whole cycle of shame itself. Again, back to, we're like, why, what are you going to do to prevent relapse,
Right.
And I don't even talk about relapse, because I'm like, these are your choices. You can pick what, because that's just already setting somebody up to fail. Is you're putting pressure, and you're already saying you're going to fail. Is what are you going to do? You're going to go to AA and all that stuff, which those are great programs. But I always start off with a question. This is the question I always start off with: is who taught you, and how did they teach you how to cope with stress growing up? And they're like,
Wow, beautiful. I might have to steal that one and add it to
go
my book.
ahead, because they'll say because they, start talking, I fell off the wagon again, I relapse, and they're in that whole, anxiety, shame cycle. And I just like, who taught you how to deal with stress, and how did they teach you? And they look at me, and I'm like, I said, I always say, no one was taught how to deal with stress,
Yep.
and nobody got their needs met in childhood. Everybody has something.
Yeah.
And so all that stuff is just ingrained in programs in your subconscious. And by having awareness alone is going to help you. But then what happens is people go, well, what do I do with it? And they don't know what to do.
Yeah.
And they just keep drinking or taking
Yeah.
pills or whatever,
Yeah, and that's exactly right. And that's why the polyvagal theory, like I said, is a way to kind of recognize that one of the reasons why people drink, one of the reasons why people get very depressed, one of the reasons why people get numb and dissociative, and they just want to check out and they want to run and hide away from everything else. The reason why the body breaks down, like I don't understand why I'm in a flare up right now, or why I'm relapsing for that matter. It's because if you think of the polyvagal framework, is that if you think of it as a ladder, to steal from Deb Dana, a colleague of Dr. Porges, and if you think of the ladder, think of the ladder goes up to a treehouse.
Mm-hmm.
So when you feel safe, there's a smile, your tone of voice. So we would say you're feeling safe. So when you feel safe, your nervous system, your body, we tend to connect with people. We can predict that when you're feeling safe, even though you had a stressful day today, you have the bandwidth. So you're less likely to relapse or to have a pain flare up. But if you go down the ladder from feeling safe, when we're stressed, and your term would be the sympathetic nervous system, or the audience may know it as fight or flight or stress. So safe, and when we don't feel safe, the nervous system drops us down to the next hierarchy in the ladder. In the middle of the ladder would be stress. I've just dubbed it as stress. Some people dub it as sympathetic nervous system. This is when people get activated. When you're activated or stressed, we tend to have muscle tension. Our nerves are most sensitized. We tend to be curt, impulsive. When you're fighting or trying to flee from what shows up inside of you, outside of you, or whomever's in between you, your life basically. And when you're trying to fight, and we will do anything and everything to get out of it. And this is when the likelihood of drinking will activate, because we're stressed and I don't know how to deal. I love that. How do you cope? Who taught you to cope? And how do we cope? Is we cope with what a nervous system, whomever you believe created it, put in a system that when you're feeling overwhelmed, you can either fight it or flee from it. And fleeing is by the alcoholism, and fleeing is when we desperately spend thousands of dollars trying to figure out how to get out of pain. So the part here is when we go from safe to stress. Remember, think of the ladder. And when you're stressed and you cannot fight or flee from what shows up, your nervous system has a beautiful mechanism that shuts you off. Safe, stress, and when you cannot fight or flee from what shows up, inside, outside, or whomever's in between you, it puts you down to the shutdown phase. And this is when the relapse happens and you just keep using, or this is when the flare up happens. And by the way, this is when your trauma symptoms, the sexual abuse, the physical abuse, the neglect, the witnessing of the domestic violence, all that stuff unfolds. So the past really just floods you to the point, like a tsunami that shuts you down into a state of shutdown. And a simple way to look at it is it's called the freeze and flop. That was basically the autonomic nervous system.
I love that. I love a visual and a ladder, because we talk about this kind of stuff, and but I don't think most of the audience listeners will always be someone in the medical profession. I love that you painted the picture of a ladder, That is just so easy to remember that ladder when you're going down, so to speak.
Yeah.
And I love that you said that you are in your trauma, because this is because anxiety, with talking with my clients, y- I was the queen of anxiety over here, panic attacks before, and all that kind of stuff. And living in frustration, unfulfilled, dissatisfied with life. I just thought I was unhappy because I worked a lot. I just thought, that's what was going on. But in dealing with anxiety, which can come in different forms, like uncertainty used to be a horrible thing for me. Now I look for the
Yeah.
opportunities in uncertainty. I love uncertainty. Bring me the uncertainty. But that's what I tell my clients is I say, because I try to explain the importance of slowing down your breath. And
Yeah.
I tell them and I practice it with them. And I said, we're gonna take 5, and I call it take 5. I just made it up, but
Nice.
we're going to breathe in 5 seconds, hold for 5 seconds, and then breathe out for 5 seconds. Cause I tell them, your frontal lobe goes
Yeah.
offline. The other parts of your brain say, we're not safe. We're not safe. And
Hmm.
so I literally say this, Les. I said, you are literally back in your childhood.
Wow. So listen, you were just so organic in that sense. That's beautiful. That's amazing.
Yeah, I love that we're connected. This is just great. I have chills. So yeah, so I tell them and I say, so the breathing part gets your frontal lobe back online, and you're calming your body. And so we'll practice it. And literally, I mean, you can feel the energy in the room just go, you know,
Beautiful.
and so I love that. So if you're okay, let me ask you this. So when you're going down that ladder, how do you get back at the top again?
Great question. Well, there's a variety of things. I think you already alluded to it. So the way I look at the breath is not just the breath. Can you imagine if we wake up and forget to breathe? So it's controlled by the autonomic nervous system. So right, so that's why it's automatic. So with that said, what can we do to move up the ladder? There's a variety of things, and that basically speaks to the vagus nerve. And so it's very mystical to many people, but the reality is this: anytime, as you said, anytime you take pause, it actually does help. Anytime you tend to slow your breath down, it does help. Let me kind of explain this. I call breath work this. Breath work is the remote control of your nervous system. Let me explain this. One of the things is the breath work is this. When you breathe, it deactivates your primitive parts of your brain. So it's like
Mm.
a volume control is what it is. And so when you deactivate the most primitive parts of your brain, specifically the brainstem and also the limbic system, the animal brain, and the emotional brain, when you breathe, you'll basically turn the volume down. So breath work is the remote control of your nervous system. When you actually do pause or even use some form of breath work, you put a wedge between your activation and the outcome of it. So in putting that pause or that breath or take 5, it's beautifully said. We now have science that shows your frontal lobe, like a Wi-Fi, comes back on. Now the wisdom in you is there.
Oh my gosh. Oh my gosh. Oh my gosh. The frontal lobe is your wisdom. I
Yes.
love that. I'm gonna steal that. Okay. I love that. I'm gonna think about that all day long. Your wisdom. Gosh, that is great. That is
Yeah.
just great. I love that. So we were talking about, stimulating the vagus nerve. So what are some ways that you teach, your clients and in your community how to stimulate the vagus nerve?
Yeah, absolutely. A couple of things is that's out there that's been evidence-based that shows you. So as simple as it sounds, humming. Do you guys remember, you might have seen movies and stories and even read in books where slaves hummed and sung while they were picking
Mm.
cotton. Ask yourself, why did they do that? Well, one reason why they actually sang was to communicate messages, by the way, just a little side note there.
Oh.
But the reality, yeah, to communicate about danger and things like that. They used to sing it.
Oh gosh.
Yeah. So
We're gonna
the
have
other
to
thing,
talk offline about that one.
yeah. And so one of the other things is this now is humming is a vibration. We're not talking like metaphysical vibration. We're talking like physiological vibration. Mm, that vibrates. So the brain likes the vibration. So humming, singing, laughing. This is going to be funny, but my patient's like, what? I'm like, you got to try it. Don't knock it till you try it. Humming, breathing, gargling.
Yes.
So this is the part where my patients go like gargling. I'm like, just try it. When you're feeling distress, put in some water. And so my patient's like, I don't want to do that. So I said, try it in the morning. If you have Listerine or whatever your mouthwash is, if you want, if that's what you do, don't put in water there after you get done brushing your teeth. Gargle for just 5 seconds and notice what it feels like in your body. Most people gargle and they go like, well, doesn't feel nothing. Well, how about after you gargle, just slow your breathing down. You'll notice there's some sort of a hum to you. There's a calmness. Now, a couple other things is this meditation, right? We talked about breath work already. Meditation is basically being able to focus on something like your breath. And every time something shows up, you kind of label it or acknowledge it and come back to your breath. So you're not bothered by it. I call it being in the middle of the tornado, being in the middle of it. So when you learn to be less reactive and more responsive to what shows up, so meditation is helpful. Now, here's the exercise, believe it or not. Now, also research has shown that your health, the gut. So, when you don't eat healthy and you're eating always processed foods, actually, we now found out that eating healthy does help the vagus nerve. But in simplicity here is one of the things I've been doing in my clinics is I use something called the Safe and Sound Protocol, SSP. This is the creation of Dr. Stephen Porges, the creator of the polyvagal theory. Basically, I deliver intervention through an app. And so what happens is this, if I wanted to speak just a little bit about it, was, so when I'm trying to stimulate the vagus nerve at the safest level, I want to use the best outcome possible. So if someone is like, what is the Safe and Sound Protocol? The Safe and Sound Protocol is basically filtered music. So check it out. You get to listen to music from the 60s, 70s, and 80s, which is cool, but that's not the intervention. Inside the music, the frequency changes. The frequency changes to match, now listen to my tone of voice. It's pretty chill, it's pretty pace. So they figured out what the brain can hear and what kind of frequency will actually send, check this out, cues of safety to the brain, to the vagus nerve, and the vagus nerve back up to the brain. So they figured it out, and Stephen Porges used this with children with autism who were hand flapping, were not engaging, as most people know, autism. It's hard to train them. They don't look you in the eye, right? They have severe things from biting their lips to banging to now noise sensitivity. So he tested this Safe and Sound Protocol. Again, it's music, but inside the music, the filter, the frequency changes. The kids who are autistic severely could now learn, and the behavioral interventions became better. So then Stephen Porges and his team tried it with trauma. This is all 2020, and this is coming forward now.
Wow.
2020 hit, so they hadn't used it with chronic pain.
Breakthrough stuff.
It is, and no one had ever used the Safe and Sound Protocol trying to stimulate the vagus nerve with chronic pain in this manner, delivering it through an app. So what happened was, when 2020, I met Porges, and he says, hey, I have this thing I've been using with autistic children and trauma. And I'm like, well, I do not differentiate between trauma and chronic pain. I often have a saying, same pantry, like same cupboard, same pantry, different shelves of the brain. So what I did was, now to stimulate the vagus nerve, it's the prehab before the rehab. And the prehab is basically, can I calm your autonomic nervous system so then you will listen? And should you need to do trauma work, if you need to do addiction recovery work, if you're coming down, you're relapsing. So if I use this and shift your autonomic nervous system to be rebalanced from check this out, from a state of stress and shutdown to a state of safety, your recovery tends to be improved. You tend to actually be more compliant with medical treatment, and you seem to process emotions with ease, or easier to process trauma emotions from the root cause.
That is astounding. That is just, I'm having another full circle moment, because part of my healing journey, what I would do, I had a routine when I was like looking at the vagus nerve and all that stuff. Oh, because by the way, you can also, because that part of your nerve, so you have your fight or flight part of your nervous system, and then the other part is your rest or digest, which is your vagus nerve, is part of that system. But nobody's resting or digesting less. Everyone's like, feels like they got to answer their phone really fast. That's fight or flight. Going through a drive-through, ordering food, your mom calling, whatever, trying to avoid going to that party you don't want to go to. All of that's fight or flight, and so what my routine would be, it's just so fascinating. I just love it. So you can lay on your abdomen for 10 minutes and that can stimulate your vagus nerve too. In the beginning of the pandemic, they couldn't figure out why people were dying, like, when they put them on ventilators, and they were still dying, and then they ended up flipping them over and they would get better. And so I would do that, and then take a cold shower, because cold shower helps too with stimulating your vagus nerve and immunity. And then I would get in my car on my way to work and listen to meditation music. Like, I did all of those things. That is just, I'm just blown away. I want to stop and pause real quick, because I want to make sure that everyone, the listeners, the audience, everyone who's watching, listening, knows where, before we go on, knows where to get this information. What is the name of the app? How do they get this app?
Sure, absolutely. So one of the things that in the Safe and Sound protocol is called SSP. The best way to do that is if you go to Google and type it in, SSP, or type in Safe and Sound protocol. It's under the company name Unite, UNYTE-ILS, Integrated Learning Systems. And that company basically is in charge of purchases. So basically, it's like the polyvagal theory in application in the clinic.
I love it. That is just beautiful.
Yeah.
I love that.